Hello skincare fans and microcurrent fans and fellow estheticians. My name is Christine Byer. I have been a licensed esthetician for 18 years and I'm just checking in. I have had a cold all of this week. I had to cancel clients in 2 days. I hate when I have to do that, but you know, it happens. It is the season. So today I wanted to talk about a new modality. I'm always excited to find something that's new and exciting, and the Scopola is amazing. It's going great. I love to put it on after I got a new radio frequency machine, and it is the bomb. And so a lot of times I'll put that on. I'll do the radio frequency, clean the skin really well, and then put that Scopola on, and it is a fantastic treatment because it gets the skin rejuvenated from the inside and then from the outside with the Scopola. That is like a slam dunk. If you have a client you don't get to see very often, or if you have an esthetician you don't get to see very often, ask her if she can do that 1-2 combo, radio frequency and Scopola. Beautiful. Don't expect it to be cheap. It's going to be an expensive treatment, but it is the bomb. So this new therapy that I've been looking at, it's called by many names, but plasma blast, fibroblast, avatar therapy. I'm actually taking a class in Tampa on February 23rd, and I will put the deets down here who I'll be studying with. The gal's name is Isabel Brown, and she is from Costa Rica. She has a very long history in the beauty industry, and she works with a doctor down there as well. And so she's done over 500 of these treatments. This fibroblast therapy is basically you take it's not an electrodesiccator, it's an electrofulgurator, meaning a cauterizer, right? But it's not exactly cauterizing the skin either, because we never touch the skin. So it's a little needle, it never touches the skin, and a little arc of energy leaps across the skin and turns that skin into plasma, right? It looks like it chars the skin. Let's call a spade a spade. But yeah, it looks like it chars the skin. So it makes these little dots. Where it really excels is non-surgical eye lifts. And it usually takes a couple times to get the lift that the person wants, especially if they have a very hooded eye. But it lifts eyes like nobody's business. And so they'll put these little dots, and anytime you touch that, it's like a little tiny lightning bolt, you know? And when that touches the skin, it chars the skin, and you get a contraction of that little spot. And so it's a series of little spots all over the skin, you know, like all over the eye, where they want to get that skin to contract and pull together. And it's so fascinating. I've been like intensely studying this. Who knows if it will be approved for estheticians to do here, but I'm just studying it for my own sake, because I'll probably be doing my face. You'll be seeing me in videos with dots all over my face. So, and they're really tiny dots, and you can actually cover them up, and they fall off by themselves in 3 or 4 days. At least that's the way Isabel does it. She tends to do less aggressive treatments and still gets really great results. And the results are basically permanent. I mean, as permanent as like a facelift would be. And they would stay depending on how well you treat your skin. So let's assume you're using Neogenesis eye serum and you are doing your mini on a regular basis. Your results are gonna be permanent, you know? I mean, as permanent as any anti-aging procedure can be if you take good care of your skin. The funny thing is, if you look at these before and after pictures, a lot, especially the European ones, a lot of these gals are permanent makeup artists, and so they're not even estheticians. So the quality of the skin is not as good as like my clients. And so I'm looking at these before and after pictures and I'm thinking, how did you let your skin get that grubby? Why would you, what's going on? And then it occurred to me that these were permanent makeup artists. So they put on microblading, where they paint on individual eyebrows, and the eyebrows look more natural now than they have ever, eyebrow tattoos. But they can do even, you know, medical stuff like putting on a new areola for somebody who's been through breast cancer and had their breasts removed. So it's really interesting stuff, but it's not esthetician stuff. And I know a lot of estheticians that are permanent makeup artists as well. So if you see some really bad skin quality, those are actually the ones that have the most wow results because they haven't done a damn thing to take care of their skin. So that's not us, right? That's not my followers. That's not me. That's not us. However, you know, when you've worked on your skin as much as you can and you still have starting to get the saggy brows. I was looking the other day and I'll show you a picture of this. I was like, ah, it was fantastic. They call it the Dragon Lift or the Dragon something. This is by Purbo. They're a German line that makes a machine. It looks like a good machine, but it looks like it's really powerful. And I think the trend is getting away from like overly aggressive treatments with this and doing lighter treatments and seeing, you know, the skin still lifts. But they'll do this pattern. So if you look at your eyebrow and you take it and you pull it up, right? It's like, oh, I'm 20 again. No, I'm younger, older, younger, older. So if you take that and they have to, you know, see exactly where you want it, and they do this little triangle of dots, and so this pulls it up, and so you kind of look like a dragon, I guess that's why they call it. And then they do the inside of the eye as well, so if you've got all these dots here and all these dots there, and that's Purbo's, they call it the Dragon Lift, Dragon Blast, or whatever. I fully expect to come back from this class with, like, she said she was gonna do my neck, and so I'm like, I can't imagine myself walking through the airport with a series of dots, like, all over my neck. They do give you a cream that covers it up and helps heal it, anti-inflammatory, but you know I'm going to be doing all sorts of LED when I get back. And after the dots fall off, I'll be doing microcurrent to help heal it up. Because those are two modalities you can safely do after to add energy to the skin to help it heal. Otherwise, they take a good 2 months to heal completely. So I'm really excited about that. That's in February. And that's it. I just wanted to give an update on what I'm into right now and excited about. You've been doing this as long as me. You have to kind of keep up with the trends to stay interested. But I love skincare of all kinds. I mean, a day back here, it still makes me really happy after all these years. And I cannot say that about my old corporate jobs. So thanks for watching. I hope you learned something. You have any questions, shoot me an email. Talk to you soon.